One thing that I do hate is how they try to use the pandemic for everything. Now, drug addiction was going strong in America long before COVID arrived, but they somehow always try to link, something that was always bad with something going on today. And no, I don't think so, y'all. So now there are a lot of people that have an addiction to opioids that are going into cardiac arrest and dying. And this is rising all across the country. So they're saying the opioid crisis and the pandemic are at least psychologically linked as isolated people turn to drugs to cope. That is so not true. So you're saying they're turning to drugs over the pandemic, but they weren't doing that before. Trust me, they were. There's a reason why the opioid plague has been going on for 22 years. Try again, for real. So this came out in the Salon January 22nd, 2021. Cardiac arrest related deaths have been risen. And this is during the pandemic. And they are noticing that all of these cardiac arrest deaths are all linked to opioids. Indeed, two of the main theories in the rise in the cardiac arrest, both compelling. First being COVID. It infects the blood vessels. At least some of the cardiac arrest deaths may be from coronavirus infection. Second, equally sinister suspicion is that the percentage of the cardiac arrest over the past 12 months have been occult. Opioid overdoses. The medical term means that the drug related cause of cardiac arrest was not recorded nor discernible. Even before the pandemic, researchers suspected opioid overdoses of being disguised as cardiac arrest. Earlier this month, researchers published a paper in the journal, and it said that it found 10% of out of hospital cardiac arrests from February 2011 through December 2017 in San Francisco were actually occult opioid overdoses. The paper adds on to ongoing evidence that opioid overdoses are being masqueraded as cardiac arrest is prevalent across the country. Indeed, since the pandemic, opioid overdoses have been increased along with cardiac arrest. That led some to wonder whether opioid overdoses are being reported as cardiac arrest. I'm sure they are. These folks, they don't like that drug addiction being on the death certificate. The way to think of it is that paramedics will arrive to the scene, they call for cardiac arrest, and will start resuscitating the patient using protocols that are directed at resuscitating the heart. Dr. Robert Rodriguez, who is the author of the study and professor of emergency medicine at the University of California, San Francisco, in an interview. So, what we have shown is a certain percentage of those patients that they assume they were having a cardiac arrest, and it turns out to be a narcotic overdose. The beginning of the pandemic, 1/3 of the country's excess deaths were not directly due to COVID-19, according to an analysis in the Journal of the American College of Cardiology. Public health experts define excess deaths as the difference between the actual number of deaths in a specific time period and the expected number based on historic trends. Specifically, data from January 1st to June 2nd, 2020, with the same time frame from 2019, showed that deaths by Heart disease increased across the country after the onset of the pandemic. Certainly, the pandemic has been stressful and afflicting every day. So, yes, it has. But, they're still talking about the hardest hit, marginalized community. And, they mean us. As Bob Henley reported for the Salon in April, EMS workers noted that before the pandemic, they would see 1 or 2 cardiac arrest calls per shift. In the beginning of the pandemic, they were attending to as many as 13 cardiac arrest calls per shifts. Wow, 13 per shift? At the time, they suspected it was COVID-19 related, but could those deaths be related to something else, perhaps concurrent crisis of opioid overdoses during the pandemic? The Center for Disease Control and Prevention reports that more than 81,000 deaths between June 2019 and May 2020 were linked to drug overdoses, and 18% jumped compared to the previous 12-month period. But when first responders attend to what is initially believed to be cardiac arrest, the protocol doesn't include administering naloxone, which could rapidly reverse the opioid overdose. Rarely do people die immediately over an opioid overdose, as it often takes hours. Rodriguez said if EMS responds to 350,000 adult cardiac arrest cases in the United States a year, then assuming 10% of those are opioid overdoses, 35,000 lives could be saved by administering naloxone. Well, they probably didn't know, especially if the person is non-responsive. You don't know if they had, not unless, you know, the same person has been overdosing so many times that they automatically know this person has drug addiction. So that's what they're saying. They're finding that a lot of the cardiac arrests going on in the country is linked to opioid addiction. I'm not surprised. But, it's no telling how many people, but, in this country, they'll put something else on a death certificate and not the real reason why that person died. Carrie Fisher, anyone? Okay. Anybody? But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.